Today, we're going to look at some price transparency data from UHC Florida, and we're going to look at applications for medical device sales and therapeutics, or medtech more generally. So, what we're looking at here is a subset of United Healthcare Florida, as I mentioned, for 44 different HCPCS codes that relate to wound care. And you can see the columns that we've got here. We've got the name of the procedure, the billing code, negotiated rate, um, service code, which would be like place of service. So we're seeing 11 here, which is for in office. There are different codes for different places of service, like an ambulatory surgical center or even hospital, outpatient, inpatient, etc. We've also got negotiated type, whether it's fee schedule or negotiated, billing class, professional or institutional, any modifiers here. Um, Other information is included. We've enriched this data with information from the NPI registry, like the primary taxonomy codes and the full name, address, EIN of the providers are also included here. So that's what we've got in this data set. This is a subset that's been filtered and cleansed and deduped. So this probably was several 100 million rows of data, but we filtered it down to 15, just over 15 million rows that and have removed zombie rates. If you're not familiar with that, you should be aware that lots of the information in these price transparency files, it can be irrelevant, especially in payer data. So let's take a look at this. In this case, we want to drill in and see who we should target in Florida to sell our wound care device or therapeutic treatment to. So what I would do here is probably start by filtering this. You can see here we've got folks all over the country, even though this is United Healthcare Florida, but we really just want to search for providers with a practice location in Florida. Um, and the NPI registry data, probably just want to look for both. Providers can fill this registry information out on their own. So it's sometimes imperfect, but it is relevant. So now we filtered down to 766,000 rows of data to just providers with a stated location in Florida. We could group it by zip code and look at that. But next, what I'm going to do is look at it by EIN so that we could try to target large groups in the state who are performing lots of these procedures or actually have, we don't know how much they're performing it. That this does not include volume data. You would need claims data. You could look at a 5% file or the Dartmouth list data set. If you have access to that, we can layer that in. But in this case, we're just doing a very simple high-level analysis. So we can see here that there are lots of rates for this particular group, or EIN has lots of these rates. We could then subgroup it again by billing code here so that we could just kind of see if there's a wide variety. And we see that they have negotiated rates for almost all of these. And then each one of these rows here would be a provider in their organization typically. So you just want to scan this list and we can see that we are getting a variety of locations as well. And maybe let's just group it by city and see if we can kind of determine where uh, this particular practice is located. I'm just doing some exploratory data analysis here. We work with all of our clients to do this kind of work and ensure they're getting data that's relevant to their use case. So in this case, it looks like Tampa is definitely a nice centrality here with this particular EIN. Um, and let's drill into it and see more specifically if we can learn anything about this group. So seeing a bunch of these, we could group by uh, the address and simply just Google it that way, or Google the provider name as well to determine that. Another technique would be right now, we're looking at both entities that are individuals and uh, organizations. So one thing we could do is simply filter this column to be organizations or apply another grouping. And maybe I'll just remove some of these so that I can kind of explore here. So, all right, within Tampa, we've got just individuals, but if I drill into like Clearwater, I can see I'm getting a bunch of uh, institution or organizations rather, like this Baycare Medical Group, for example. So this is just a quick way that we could filter this information to drill down to potential targets. We can also reorganize all this stuff. So maybe I want to go look at just these org groups and I can filter to that and remove this. So now I'm just looking at organizations and I'm looking at Florida. I could filter it to a specific market by zip code or just by city name as well. So maybe I want to start in Tampa. Um, sorry, equals Tampa, and maybe I also want to add Clearwater as well. I'll look at both of these and hit apply and start to drill into this. So here we could see that instead of EIN now, I'll probably uh, put it by provider name for in this use case, remove that. And now I've got a list of providers in Tampa that I should probably look into and research and see if these would be good prospects for my particular device. Um, this number here specifies how many negotiated rates they have within this. These are all Tampa, so I can remove that. Yeah. So this is probably a view I would save off and send a link to the client and let them know, hey, if you're interested in Florida, maybe start with Tampa, and here's a list of organizations. Get some feedback from them. Is this going to work for you? And looks like it's valid. Then we would refine it a bit further and hand it off. So that's how you can use GigaSheet for med tech, medical devices, therapeutics to target potential buyers. Thanks.